Hi everyone, I'm Matt Hurt with Wound Care Support. The purpose of this video today is to show you guys the best way to market for our client, US Wound. We're going to take you through the steps and the tricks of how to get the audience best involved and what you should say in case of it. Our primary focus is home health care. You want to make sure that you are focused on calling them as often as possible and getting in front of their director of nursing and all of their nurses. Their nurses are going to be the ones that recommend chronic wound care, and so it's important for them to know you and also about US Wound. Eventually, we will start to work into senior living facilities and transitional care facilities, but at this time, your focus should be on home health. The way that we market for US Wound is a three-step approach. We talk first about who they are as a company, what they do for patients, and what they do differently than other wound companies. As we go through this, I'm going to show you those three steps and teach you how to use each one of them. When presenting for US Wound, a few things are important. You want to make sure first that everybody has their own pamphlet and that you yourself have a pamphlet. You'll be in front of a group of nurses and directors of nursing and helping them to understand more about US Wound. When you're doing this, it's important to remember that you are representing US Wound, and so you need to dress appropriately, okay? Make sure that you are in business casual attire and in a professional setting and speaking in a professional manner. Now, when you're explaining who US Wound is, a company that treats chronic wounds for in-home patients. They go to the patient's home and work in conjunction with you, the home health. Our objective is to bring in-home advanced wound therapies to your patients to make sure that they can heal faster and better than they were healing before. We work in partnership with you as our nurses and us as the wound care treatment to make sure that our patients are taken care of. And this is section part 2 of what we do. Now you're going to want to make sure that you highlight a few products when it comes to US Wound. There are a few of them that make them a little bit different than other companies that are out there. But again, our focus is not going to be in the grafting. We want to make sure that we focus on advanced therapies here and lightly touch on grafting at the end of that. It should sound something like this. US Wound uses a lot of different products. The majority of them are made by Ergo. Ergo is also a local Texas company that we trust our products very much with. We use products like Bosch. Everybody has heard of Bosch. Everybody in the room will have heard of Bosch, by the way, so you can just add. We use Ergo bandages to help the patient's wounds heal faster than they were healing before. We have a MolecuLight imaging device. Very important. This is not a camera, it's an imaging device. The MolecuLight itself will help to measure not only the depth and width of a wound, but it also helps to measure bacterial load. These things are more important because right now, the nurses in the room are doing this with a paper tape measure and really decimating at it, and this will give them an extra. It's made to take the slop directly off of the patient's wound and help them again to have a much cleaner, faster healing experience. We also do our own ABI testing, so they don't have to take care of that anymore. And then of course, if we do get as advanced as needing a skin graft, we do that in multiple different stages as well. There are a couple of tools that you're going to want to have at your disposal for this, but there are mainly two parts here. First thing is US Wound has a huge emphasis on communication with their nurses. This is where you'll want to pull out your red folder. Now, for the nurses in the room, this will be a big deal. It's something that seems very, very simple, but other wound care companies are not doing this for them. So it's important that you take the time to really explain and break down what this folder does for them on a day-to-day basis. It should sound something like this. One thing that makes US Wound different is we value communication with our nurses. So we've done something that's very simple, but also very effective to help you in your day-to-day. This folder right here will be in every single patient's home. And what's inside of it are orders from our nurse practitioners. So in the circumstance where the orders did not get faxed 24 hours to the fax or email within 24 hours to your home health agency, and you show up at the patient's house, you'll have written and signed orders that allow you to go ahead and take care of the patient in the correct manner. This way, there's no miscommunication between the nurse practitioner and yourselves so that we can effectively take care of the patient more quickly. Dr. Dombrowski, who is local right here in Texas. In addition to Dr. Dombrowski, we have a medical consultant called Dr. Mitchell, who is the largest wound care doctor in the state of Colorado. The objective here is so that these nurse practitioners can communicate with them on any problems that they have at any period. Now, this is something that, again, not a lot of other wound care companies will do, but it allows us to be a little more effective because if they run into something that they can't figure out, they can contact Dr. Mitchell or Dr. Dombrowski right away and make sure that they get a resolution as quickly as possible. Finally, it's important to drive home the point that US Wound is a Texas locally owned company. If Tracy's not at your meeting with you, know that she's readily available to talk to any of these nurses or director of nursing that would like to communicate with her. It's extremely important because, again, these home healths aren't used to people who are willing to talk to them from an ownership level. We are fortunate to have Tracy in that because she will get directly hands-on involved with them. And that's, again, something that sets us apart from other wound care companies. Okay. An important thing to remember is that these are extremely busy people. So you should only be taking 10 to 15 minutes of their time. Anything more than that, you should be moving on to your question round so that they can get the desired information that they need to make this feel like an important meeting for them so that they can refer patients more quickly. Ask for questions. And there will always be questions. The first question will always be,
what insurances do you take?
What insurances? Pay the patient care the fastest. We also work with some Advantage plans, and PPOs mainly have the highest success rate. We do not work with WellMed, and there are a few other PPOs that we have low success rate with as well. What makes it a chronic wound is a wound that will not heal for at least 4 weeks. Now you'll see several different common types of these. However, there is one that we do not treat. We do not treat lymphedema patients. So if it is a lymphedema wound, which is chronic, we are not able to. Regularly is, what's your coverage area? The simple answer to this question is, we cover the entire state of Texas. We will place nurse practitioners where they need to be in the small towns, in the rural communities, wherever we need to go to. That you don't know the answer to. Now, a technique that first and foremost you'd like to identify to the room is that you are not a medical person, and it's okay to admit that. As a matter of fact, it will give you some grace when it comes to answering these questions for a lot of these nurses. I say something like, I'm not fortunate enough to be a medical person like all of you, so I don't know all of the technical answers to these, but I absolutely can find out because there are tons of people in our company that I use as a resource to answer questions just like that. So let me get back to you on that. The final thing that you do in your presentation is to talk about how to refer a patient. Again, every nurse in the room should have one of these cards. And it's made to go on their desk that if they ever have a question about how to refer a patient, it's sitting right there for them. Go points 1 through 5. And very simply say it's as simple as calling us, faxing us, or even scanning the QR code. On here, there's a phone, fax, and email address, as well as a QR code for them to fill out with any kind of referral or question that they need. It's also extremely important that you leave behind your contact information, as you are going to be the liaison between US Wound and the home health. And if they have any problems, it's important that you're able to take that communication and transfer it over to either myself, Aaron, or directly to Tracy if necessary.